Dacarbazine Vial is a medication used to treat specific types of cancer, including skin cancer and Hodgkin's disease. It is a chemotherapy drug that works to slow or stop the growth of cancer cells. The medication is typically administered by a healthcare professional, and the dosage and timing will depend on the individual's specific condition and treatment plan. It is important to follow the healthcare provider's instructions carefully for the best results. Dacarbazine Vial is administered through a vein by a healthcare provider according to your doctor's instructions. The dosage is determined based on your medical condition, body size, and how you respond to treatment. Nausea, vomiting, and loss of appetite are common side effects of Dacarbazine Vial. Your doctor may prescribe medication to help with these symptoms. Eating small meals and limiting activity may also help. These side effects usually decrease after 1 to 2 days. Diarrhea, flu-like symptoms, blurred vision, and flushing/numbness/tingling of the face may also occur. Temporary hair loss is also possible, but normal hair growth should return after treatment. Serious side effects are possible, so it's important to be closely monitored by your doctor. If the medication leaks into the surrounding tissue, it can cause serious damage, so be sure to tell your doctor if you experience pain, burning, redness, or swelling at the injection site. Serious side effects such as mouth sores, confusion, seizures, or allergic reactions are rare but should be reported to your doctor immediately. If you notice any other effects, be sure to contact your doctor. Dacarbazine Vial may cause serious blood disorders, such as a low number of red blood cells, white blood cells, and platelets. This can lead to anemia, lower your body's ability to fight infection, and increase your risk of bleeding. It may also cause rare but serious liver problems. These side effects can rarely be life-threatening. Your doctor will monitor you closely while you are receiving this medication. If you experience symptoms such as nausea/vomiting, unusual tiredness, pale skin, easy bruising/bleeding, signs of infection, dark urine, yellowing eyes/skin, or stomach/abdominal pain, be sure to tell your doctor right away. Before using dacarbazine, it's important to let your doctor or pharmacist know if you have any allergies or if you have a history of kidney disease, liver disease, blood disorders, decreased bone marrow function, or current infections. It's also important to tell your healthcare professional if you are planning to have any immunizations or vaccinations, as well as to avoid contact with people who have recently received live vaccines. Dacarbazine can make you more likely to get infections or may make current infections worse, so it's best to stay away from anyone who has an infection that may easily spread, such as chickenpox, COVID-19, measles, or the flu. To lower the chance of getting cut, bruised, or injured, be cautious with sharp objects and avoid activities such as contact sports. This medication may rarely cause blurred vision, so it's important to avoid driving or using machinery until you are sure you can do so safely. Dacarbazine may also make you more sensitive to the sun, so it's best to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. If you get sunburned or experience skin blisters or redness, be sure to inform your doctor right away. If you are pregnant, this medication should only be used when clearly needed, so be sure to discuss the risks and benefits with your doctor. It is not recommended to breastfeed while using this drug, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when taking Dacarbazine Vial. These interactions could impact how your medications work and increase your risk for serious side effects. To minimize the risk, keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial to always consult with your doctor before starting, stopping, or changing the dosage of any medicines. This will help ensure the safe and effective use of Dacarbazine Vial. If someone has taken too much dacarbazine and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. To make sure that Dacarbazine Vial is working properly and not causing any harmful effects, your doctor may need to do regular lab tests, such as complete blood counts. It's important to keep all of your scheduled medical appointments and lab tests. If you have any questions about these tests, be sure to talk to your doctor for more information. Make sure to take each dose of Dacarbazine Vial as prescribed by your doctor. If you happen to miss a dose, consult your doctor or pharmacist immediately to establish a new dosing schedule. This medication is administered in a medical facility under the supervision of a healthcare professional. It is not meant to be stored or used at home. Dacarbazine Vial is typically used to treat certain types of cancer, such as skin cancer and Hodgkin's disease. The dosage and timing of administration will be determined by a healthcare provider based on the individual's specific condition and medical history. It is important to follow their instructions carefully and to attend all scheduled appointments for this treatment. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.